మీరు కనుక ఫస్ట్ టైం మా ఛానల్ చూస్తున్నట్లయితే లైక్ చేయండి, షేర్ చేయండి, కామెంట్ చేయండి. ప్లీజ్ సబ్స్క్రైబ్. మేము అందించే లేటెస్ట్ వీడియోల నోటిఫికేషన్ కోసం పక్కనే ఉన్న బెల్ బటన్ని ప్రెస్ చేయండి.
Madam, what is the meaning of allergic rhinitis?
Allergic rhinitis is a condition in which the patient has an excessive or a hyper immune response to certain harmless chemicals which are found in the atmosphere called allergens, which are inhaled from the air into the nose and the upper respiratory tract. So this leads to an immune response in the patient's body, which is abnormal and exaggerated. So that condition leads to certain symptoms in the patient's body, and this is called allergic rhinitis.
Okay, madam, what are the causes of allergic rhinitis?
So basically, I'll tell you about the mechanism of how the allergic rhinitis works. So when the patient is exposed to these allergens, that is certain chemicals in the atmosphere which the patient is allergic to. It could be dust, pollen, or it could be certain chemicals, or it could be cold air, or it could be animal dander, or it could be certain other intake of certain food items which the patient has allergy to. So when these allergens enter the body, either through the nose or through the gastrointestinal route, then these allergens will trigger a reaction. So first of all, they produce IgE antibodies, which are allergic specific antibodies within the patient's body. So these antibodies attach to certain inflammatory cells called mast cells. And the allergens go and attach to these mast cells which contain these IgE antibodies. So the mast cells in turn, they will rupture and they will release certain chemicals. And they will also activate the other inflammatory cells within the body. So altogether, it produces a cascade of allergic reactions and produce certain symptoms in the body, which is in turn basically called as a allergic response or allergic rhinitis.
Okay. What are the symptoms of allergic rhinitis?
So this degranulated mast cell and the inflammatory mediators of allergic rhinitis will produce certain symptoms very suddenly. Like the patient may be normal 1 minute, and once the exposure to allergen occurs, then all these symptoms start all of a sudden. The most important symptoms will be itchiness of the nose, throat, ears, sometimes even the eyes. That is because of a release of a chemical called histamine by these mast cells. So they will cause extreme itchiness. And also it will lead to excess mucus production in these, in the nose passage and the throat, upper respiratory passage. So there will be excess of runny nose. It may be watery or it may be mucus-like. There will be sometimes watering from the eyes also and redness of the eyes. So itching, then excess of secretions, runny nose, etc. Then the third symptom will be sneezing. So the patient will have a bout of sneezing, like multiple sneezes, about 4 times, 5 times, sometimes even 10, 20 times. Uncontrollable paroxysmal sneezing on exposure to the allergen. And the fourth symptom will be nasal congestion or blockage. So because this allergic rhinitis will cause edema, so fluid accumulation within the mucosa of the nose. So the mucosa gets swollen up. The turbinates also get hypertrophied. So the nose will be completely blocked and the patient will have breathing difficulty. So this is again one more symptom of allergic rhinitis. And then there are other symptoms like cough. If the allergic response spreads into the pharynx, then it can lead to cough. Sometimes it can enter into the lower respiratory airway. It can lead to wheezing, breathing difficulty also.
Okay, ma'am. How do we diagnose this condition?
So once a patient comes to us with these very typical symptoms of allergic rhinitis, it is sneezing, itchiness of the nose or throat, watery discharge or rhinorrhea, clear watery discharge from the nose, and then nasal congestion. That is when the patient typically has these symptoms in the early morning, or when exposed to cold air or exposed to dust or certain fumes, like it can be perfumes or any strong smells, or after intake of certain food items. Typically the symptoms will arise after this exposure to the allergen. So when these symptoms happen repeatedly and they are not settling by themselves, or in a particular season, it may be seasonal during either the pollen season or during summer or during winter, or it may be throughout the year, as in case of perennial allergic rhinitis. So when such a patient comes to us as an ENT specialist, we examine them and we look for certain symptoms, signs. For example, there will be pale, boggy turbinates in the nose. They will be very pale and they will be swollen. Then there will be some thin mucus discharge or watery discharge in the nose. There will be some redness of the eyes. Also, there may be some other associated symptoms, like if the allergy has been present for a long time, there may be certain polyps which are found in the nasal cavity. The polyps are basically translucent sac-like protuberances in the nose, which we can see on nasal endoscopy or on direct examination. So they're called as polyps. So, and then also we examine the throat to see if there's any congestion or postnasal drip. Then we auscultate the lungs to see if there's any wheezing in case of allergic bronchitis cases. So we examine the patient. And then we subject them to certain investigations. So first of all, we do some blood tests. Typically, serum Ig levels have to be checked. So in an allergic rhinitis patients, the serum Ig levels may be raised. Then they may also have eosinophilia in their blood. So absolute eosinophil count will sometimes be raised in case of allergic rhinitis patients. Other than that, there are specific tests. For example, the skin prick test. This will help us, guide us as to what the patient is allergic to. So we subject the patient to this patient's skin is pricked with say about 25 to 50 allergens which are present commonly in the atmosphere or in our food items. For example, some vegetables, some nuts, or some non-veg items or milk, etc. And then certain aeroallergens like pollen, animal dander, dust, etc. So after subjecting the patient to the skin prick test, we have a fair idea based on the report that what is the patient allergic to. So once we have that idea, then we can do further treatment. In cases where we suspect complications, for example, sinusitis or polyposis of the sinuses or fungal sinusitis, or if there is any structural deformity along with the allergic rhinitis, for example, deviated nasal septum or turbinate hypertrophy, then a CT scan of the paranasal sinuses also helps in diagnosis.
Madam, what are the medical treatment of allergic rhinitis?
So first of all, we have to avoid the allergen. That is the first and most basic principle of treatment of allergic rhinitis, that avoid the allergen. So basically, when you're going outside, wear a face mask. So that will protect us from smoke, dust, fumes, or other allergens which are present in the atmosphere. Then even at home, women who are having allergic rhinitis are instructed to use a mask when they are dusting or cleaning certain articles, or when they are using a toilet cleaner to wash in the washroom, etc. Or mosquito repellents also sometimes, or when they are lighting incense sticks. So incense stick or certain strong fumes like, some other strong fumes can also lead to using of perfumes, etc. These can also trigger an allergic response. So they should avoid that. When they are cooking, then especially the pungent fumes while cooking have to be avoided by either using an exhaust fan or a chimney, or using of mask, etc. So these basic avoidance of allergens. Then certain food items, for example, cold food items, cold beverages, ice creams, cold water. Then citrus fruits can also trigger allergy. So generally we ask them to avoid citrus food items. Or if they have milk allergy or nut allergy, we ask them to avoid that. So avoidance of the allergen is the first and foremost. Second thing is treatment. So to control the allergic response, we prescribe them antihistamines. So antihistamines will reduce the inflammation as well as the symptoms of allergy. For example, itching of the nose, sneezing, watering of the nose, and also blockade of the nose. So these will be symptomatically treated by antihistamines. Then we also give them mast cell stabilizers and anti-interleukin medications, which will reduce the inflammatory response. Locally, we prescribe them intranasal corticosteroids that reduces the inflammation in the nose and the paranasal sinuses. So such treatment has to be done for a long time. For example, up from 1 month to 3 months, sometimes even longer, depending on whether the patient has seasonal allergic rhinitis or perennial. And we call the patient for follow-up, say after 1 month, to see what is the response. If we suspect some secondary infection also, we give them a short course of antibiotics along with the antihistamines and intranasal corticosteroids. And then also we ask the patient to take certain follow some general principles. For example, exercising, doing pranayama to clear their nasal passages, a good nutritious diet and good sleep. All these will improve the general immunity of the patient.
Okay, madam. Which cases require surgery?
So complicated allergic rhinitis, which leads to sinonasal polyposis, that is, all the sinuses and the nasal cavities are full of allergic polyps which block the drainage of the sinuses, leading to secondary sinusitis. Or the medication also may not work when the sinuses and the nasal cavity are full of polyps. So in that case, we first cleared the polyps by endoscopic sinus surgery, And then we ask the patient to take the medication for allergic rhinitis to prevent any recurrences and to improve their lifestyle. Secondly, if the patient suffers from fungal sinusitis as a complication of chronic allergic rhinitis, in that case also, they have to be subject to surgery immediately to clear the sinuses of the fungal ball or aspergillus. Or if it is an invasive fungal sinusitis, they also require antifungal treatment after that. Then thirdly, if there are any complications, for example, any orbital cellulitis or any other intracranial complications, they too require surgery. And fourthly, if there are associated structural abnormalities like a deviated nasal septum or turbinate hypertrophy, so such patients also require surgery in case of allergic rhinitis.
Madam, can this condition leads to any complications?
Yes. So allergic rhinitis, if it is neglected, as I mentioned, it can lead to extensive sinonasal polyposis. It can lead to sinusitis. It can lead to other complications. For example, the infection can spread, the allergy can spread downwards into the lower respiratory tract, and the patient can suffer from bronchial asthma. So, so these are the certain complications known with allergic rhinitis.
Madam, how to prevent and control this disease?
So prevention, as I mentioned earlier, that prevention of the allergen is the most important. So avoid exposure to the allergen by all means. When going out, wear a mask. Then avoid the usage of certain food items which will trigger the allergic response. And avoid exposure to fumes, smoke, dust, and then incense, perfumes, or any strong odors. Second thing is be on anti-allergic medication, which has to be used not symptomatically, it has to be used prophylactically for a period of minimum 3 months to 6 months, sometimes even a year, and follow up regularly with the ENT specialist to see whether the symptoms are improving, whether further medication is required, and whether follow-up of the blood test, that is serum Ig level and eosinophil count, has to be done to see whether the parameters are improving.
Okay, thank you so much, ma'am.